Right. So you are the GP and your name is Dr. Sally Brown. Okay. You're the GP and you're Dr. Sally Brown. And then, okay. Right. So this is an urgent letter. So present visit will be first important. Admission and emergency department. And this is a referral. So it is an urgent referral. Okay. So it is a referral letter and it is an urgent referral. So you are writing to the gynecology registrar and you are writing to the Spirit Hospital and then you are South Brisbane. Okay, so these are the bits of information. These are the bits of information. So that's very, very essential. Yes. So go through that one, what I'm telling. So you'll get a clear picture. It's an emergency letter. So in the emergency letter, you should always write the present visit in the first paragraph and the other visits in the next paragraph and general information in the third paragraph before conclusion. Okay. Right. That's awesome. You are done very nicely. Yes. Okay. So first paragraph, first part and sixth part. First component and sixth component are already observed there. Okay. So line number 1, gynecology registrar. So are you right? Do you know the name? No, don't know. Okay. Then Spirit Hospital, South Brisbane. The seventh component is here. Sixth component is related to this. And first component address 1, 2, 3. Gynecology register, Spirit Hospital, South Brisbane. Okay. So let us see what you have written. Gynecology registrar, right? Oh my God. Oh, doctor, you don't know the spelling of registrar. How come? Gynecology registrar, the spelling mistake. Okay. You should know registrar spelling is, yeah, here it is. Copy text. Gynecology registrar, that is the spelling. Okay. Spelling mistake. So it is wrong. A and E department, right? Accident and emergency department. Nah? Why do you want to write shortcuts? Huh? A and D, that is note. Notes is different. Don't write like how it is there in the notes. Accidents and emergency department. Accidents and emergency department. Like that you have to write. So second one, you have to change your style. That is correct only, but quality is. So you are writing as if you are writing in the note only. In the case notes, it is like that, and you are writing like that. That's all. There is no difference. Accidents and emergency department. Okay. Or accident and emergency department. Okay. Let us check the Google what it says. So A and E department. A&E department. So A&E department means emergency department. So emergency department, okay, and also known as emergency department or casualty. So it's emergency department. Okay, right. That's very clear. Accident and emergency department. Here it is. Okay, accident and emergency department. Fine. Accident and emergency department. That's good. And Spirit Hospital, South Brisbane. Spirit Hospital, South Brisbane. So 4. Gynecology Registrar, Accident and Emergency Department, Spirit Hospital, South Brisbane. Very good. Very good. Excellent. Fine. Wonderful. Only some small mistakes are there. You have to check it out. Then next. Okay. That's clear. Then 16 February 2013. Okay. Dear doctor. Okay. Okay. Doctor and registrar. Dear registrar, you can say directly. Because you are writing to a registrar, you are not direct writing to doctor. Doctor has a special designation, that is registrar, gynecology registrar. Okay, on duty gynecology registrar, and ask for urgent assessment. Okay, so on duty. So it is on duty, registrar on duty, gynecology department. Okay, registrar on duty, gynecology department, A&E, okay, department, gynecology registrar, okay, A&E department, okay, fine. South Brisbane, that is fine. Next one, the date, 16 to 13, that is the date, emergency, 16 February 2013. So 16 February 2013, that's right, dear doctor. So dear registrar would be better. Okay, doctor means there will be many doctors, but registrar is only one. So which is better, that you have to write. No? Dear gynecology registrar. Okay, or dear registrar. You can say just like that. Dear registrar is better. This is the better option. Dear registrar. Okay. Then regarding Miss Cathy Jones, comma, 25, aged 25, 25 years old. Don't write. So 2 words. Why you want to waste? Aged 25. Aged 25. Aged 25. You can write like that. So you can remove that one and say aged 25. That you can put there. So you remove all these things and just say aged 25. So this one. This is better. Age 25. Miss Jones is being referred for urgent assessment of a suspected ectopic pregnancy. Okay. So why don't you improve this quality? Okay. Are you ready to write down, Renash? Write down.
Yes, sir, writing.
Miss Jones, whose signs and symptoms are suggestive of ectopic pregnancy. Okay. Miss Jones, comma, who has signs and symptoms suggestive of ectopic pregnancy, or whose signs and symptoms, whose signs and symptoms are suggestive of ectopic pregnancy Miss Jones, whose signs and symptoms are suggestive of ectopic pregnancy, then here you get is being referred for urgent assessment, immediate evaluation. Okay, what is there in the case notes? Don't write the same thing. So it is given here urgent assessment, and you are writing urgent assessment. There is no meaning. Your copy paste. Dr. Renash, I don't want copy paste, okay?
Okay, sir.
Transfer. Urgent means immediate. Assessment means evaluation or a definitive diagnosis. Okay. Okay. Urgent assessment. Okay. Immediate evaluation and immediate evaluation and immediate evaluation and okay. Okay. So okay. Today pain has worsened overnight. Now severe constant pains, bleeding overnight. Also felt pain and questioning is shoulder tip pain. Also objective is this one. And on vaginal examination, pregnancy test positive, urine defect clear, assessment suspected pregnancy, and are instructed to send her. Okay, urine register and ask for urgent assessment, and are instructed to send her. Okay, urgent assessment and appropriate management. Okay, fine. We can say like that. Urgent evaluation and appropriate management. Is that clear?
Yes, sir.
Miss Jones, whose signs and symptoms are suggestive of ectopic pregnancy, is being referred for immediate evaluation and appropriate management. Very good. That's enough. Okay. Next one. Okay. Right. Today, severe and constant pain in the right iliac fossa region, combined with slight vaginal bleeding, which occurred during night time. Okay, during night time, during the night. During the night is enough. Night time is not necessary. During the night, the is definite article, means the previous night. Okay, time is not necessary. During the night, okay, has been reported. Very good. This, even if you don't write also, it's okay. Has been reported. Pain in the right iliac fossa region combined with, okay, has been reported. Very good. Additionally, a left shoulder tip pain. A left shoulder tip pain. Okay. Okay. So A pain, 2 pains, 3 pains, like that. Don't write. It's calm. So left shoulder tip pain is enough. Don't write A. A pain. A pain, one pain. That means one pain. What do you mean by that one? A pain. Okay. You can say some pain, more pain, much pain. So better uncountable. Okay. Additionally, left shoulder tip pain. Pain in the left shoulder tip. Like that you can write. Or left shoulder tip pain and faintness. Faintness. What do you mean by faintness here? Felt faint. Faint while waiting. Faint, faint. Not very clear. Case notes has little problem here. Felt faint. What do you mean by faint? Okay, fainted. Okay, that is an action. That's different thing.
Can you write dizziness?
Yeah, dizziness would be fine. Okay. So let us take that one. Fainting sensation, you can say otherwise. Faint.
Sir?
Faint is verb. Faint, fainted, fainted. Okay. Faint is C to feel faint. She felt faint with hunger. To feel weak as if you are about to become unconscious. Felt faint. Okay. So felt faint while waiting in reception. Yeah. So you can expand that one and write in a better sentence. That would be fine. Mild dizziness. Yeah, you can write that one. Change the words. Don't write the same words. That is what I mean to say. Felt faint
Okay.
is already there. Same word you are writing. Faintness. Instead of that one, you can say felt dizziness. Okay. Has also been mentioned. And two things are there. So have also been. Have. Two things. One is pain and faintness. Two things. Okay. Dizziness you can say instead. That is better. Also been mentioned. Have also been mentioned. Have. Change the words if possible. As far as possible, don't copy the same words. Okay, you can say dizziness. Okay, have also been mentioned. Okay, on palpation, guarding and rebound tenderness were noted in the right ilia fossa region. Very good. A vaginal examination revealed a vaginal examination. Why just say vaginal examination revealed? That's enough, no? One examination, two examination, just examination. Vaginal examination revealed cervical excitation and severe tenderness in the right fornix. Okay. A positive pregnancy test has been reported. Pregnancy test has been positive. Okay.
Okay. Pregnancy test.
Okay. Positive pregnancy test. There is nothing called positive pregnancy test or negative. Test is test. Test may be positive or test may be negative, but it is not a positive pregnancy test. Okay.
Yeah, okay, sir.
Okay. It
So
cannot be like that. So, pregnancy test which was conducted was revealed positive results. Was positive. The pregnancy test was positive. Okay. So this you can say change it. So then you can go there to the case notes once again. Pregnancy test. Result positive. Yeah, see, pregnancy test result was positive. Okay. The result of the pregnancy test was positive. Okay.
Okay.
You understand?
Yes, sir.
So you can change this. A positive pregnancy, there is nothing called a positive pregnancy. Nothing in the world there is like this. Pregnancy test was positive. Results were positive. Test will not be positive. Results will be positive. Test is test only. Okay, it reveals positive results or negative results. That's all. So has been reported. Okay, her vitals were normal and urine dipstick was clear. And so vitals were unremarkable and both the vitals and the urine dipstick, okay, were unremarkable. So like that you can join the sentences or her vitals and her vitals were normal and urine dipstick was clear. Okay, fine. Avoid using her. You can say the vitals. The vitals. Okay, normal vitals and urine dipstick were mentioned. Okay, mentioned already you have written here earlier.
So observed.
Mentioned already you have written.
Can you write
Okay,
observed?
informed.
Informed. Okay, fine.
Another word you take. No, don't take the same words. See, here
Informed.
also reported. Here also reported. You are repeating the words. Okay. Okay. Next one. Uncertainty. Uncertainty spelling mistake. Uncertainty spelling mistake. Okay. UNCERTAINTY. Uncertainty. No NITY. There's a spelling mistake. Uncertainty regarding the last. The last. The first. Okay. The last. The next. The previous. Regarding time. The past. The present. The last. The present. The future. The coming. Like that. You understand, Dr. Renash?
Yes, sir.
The last. Okay. No problem. You are an extraordinary doctor, but your English should be improved. Okay.
Yes, sir.
Don't get upset when I am correcting too many things. The
No,
last
no, no.
menstrual period uncertainty has been experienced due to irregular bleeding since using progesterone. Since the commencement of progesterone only pills.
Announcement.
Since using, no, since the commencement, from that time, no. Since the commencement, that means starting time. Okay. While using, otherwise while using. Okay. Otherwise, since, when you say since the starting time, you have to, since the commencement of progesterone, only pills. Since the commencement, the starting point, the commencement of progesterone only pills. Is that clear?
Yes, sir.
Progesterone. You cannot break like this. And progesterone. So you can make progesterone like that. And T-ron you can bring, or ron you can bring here. 3 letters you can bring. Progesterone only pills for the past 2 months. For the past 2 months. For the past, the last, the past, the previous. Remember, you don't have an idea about this, and that's why every time you are making here also the last, the past. Okay, make it a habit for the
Okay,
past 2 months or for the last 2 months. Okay, in view of the above mentioned, there should be a hyphen here. There should be a hyphen here in between these two things. There should be a hyphen here in view of the above mentioned circumstances, comma should be there here. An urgent assessment of suspected and adjust of a suspected. There no need this one. No need. So again, why you need to tell ectopic pregnancy? Already you told. Okay, an urgent assessment and an assessment. 1 assessment, 2 assessments, 3 assessments. Don't write like that. Just assessment. Urgent assessment better. Urgent assessment means immediate evaluation. 1 evaluation, 2 evaluations. Don't write like that. Make it uncountable. Okay, it contains of many things in the assessment. Urgent assessment and follow-up action plan. You can say some other thing. Okay, urgent assessment, evaluation. Okay, definitive diagnosis. You can write like that one. A definitive diagnosis. Okay, and appropriate action plan, follow-up action plan would be profoundly beneficial for Miss Jones. Very good. So change urgent assessment. Again, you are writing same thing in the case notes. You are writing in the introduction. You are writing in the conclusion. See urgent assessment. Why are you taking the same words which are already there? Okay. Right. So you can see here. In view of the above mentioned circumstances, comma, urgent assessment. So change it. A definitive diagnosis and appropriate follow-up action plan would be profoundly beneficial for Miss Jones. Please keep me informed. Keeping me informed regarding the updates. Updating me with the keep me informed of the outcome. Updating the outcome, updating me with the outcome would be is requested. Okay, updating
Is requested.
me with the outcome, consequences, updating me with the consequences is requested. Updating me with the consequences. Okay,
So can
updating
you
me.
write updating me with the consequences would be highly appreciable, something like that?
That already we have written highly appreciated, profoundly beneficial. Okay, highly appreciated. No need to appreciate. Why should we appreciate? Okay. Okay, if you want to write, you can write like that one. But why should we appreciate a person, government official, or a person who is doing his duty? Need not appreciate a person who is doing his duty.
Yeah.
Okay. He is not going out of the line and doing. It is his responsibility and he is doing. So no need to appreciate the person. Person is not important. The doctor is not important here. The patient is important. Okay.
Okay.
Updating me with the consequences.
Okay, sir.
Is requested. All right. And in case 2 words, not 1 word, separate. Okay, 2 words, in separate, case separate. In case, comma. Okay, any additional information is required. In case any additional information is required, please do not hesitate to contact me. That's it. So we got that one. It's fine. Okay, same thing, no correction. So everything is fine. Please do not. So no need to write all these things. Why? It's already corrected. Correct only. In case, like the 2 words. Any additional information is required. How can you break this word required? No, you cannot break this word actually. Required. You cannot break this word. There are a lot of rules, so don't break the word as far as, if you don't break, no problem. This is a mistake, very big mistake. It's a, grammatical mistake. Splitting the word. Okay. For example, there is a word, you have information. You can write like this, in dash for dash may dash shan. So this is 4 syllables word. Information. So when you are breaking the word, you have to break in between wherever these dashes are there. You cannot separate in between. Information is wrong. You cannot break here. This is wrong. Because you cannot break between the syllable. You can break only in between 2 different syllables. Where is that hyphen? There you can break. You understand now, Dr. Renash?
Yes, sir.
Yeah?
Yeah.
So that is how it is going to be. Yeah. Information. Okay, information. So now how you can break? See, first thing is you cannot break in between. So in you cannot break. I and N you cannot separate. F O R separate you cannot break. F O and R separate. M and A separately you can. So shan. This one you cannot separate this syllable. T-I-O-N. T-I-O-N should be together only. M-A should be together only. F-O-R should be together only. You cannot break F-O-R. And you cannot even break I-N. So like this. That means these 4 syllables cannot be broken. In between you can break I-N and F-O-R. Here you can break. F-O-R and M-A you can break. And T-I-O-N here you can break. That is number 2. Then when you are breaking, at least 8 letters should be there. Information. There are more than 8 letters, so you can break. But when you are breaking, that side 4 letters, this side 4 letters should be there. That means here after in you cannot break. After in one side and F formations, another side you cannot break. Because So here you cannot break at all. But information, you can break like this. INFOR and MATION. Like this you can break. This is one way you can break, because that side 4, this side 4 at least. Then next one, you can also break like this. Information, okay, and shun.
Yes,
Like this you can break, because 4 letters that side and 4 letters this side. Is that clear, Dr. Renash?
yes, sir. Yes, sir.
So you don't know how to break, don't break, okay? Better you don't break if you have any confusion. Okay, next
Okay.
one. Why are you writing capital letter for sincerely? Okay. Sincerely, you no need to write capital letter. It should be small letter. Okay, general practitioner. General practitioner. Okay. And you are general practitioner. And your name is Dr. Sally Brown. Why don't you write Dr. Sally Brown? Okay.
Okay.
You have to write Dr. Sally Brown. Okay.
Okay.
You got
So,
it?
should I,
Your name
okay.
is Sally Brown.
Should I write
Okay,
before GP?
Dr.
Okay.
Sally Brown. So why you did not write that one? You have to write there. Is that clear now?
Yes, sir.
So any more doubts?
No, sir. It's clear.
Okay, word count is a little less, I guess, maybe 170 or something like that. You can increase a little more, okay?
Okay, sir.
See what you can add else, you can add. Okay.
Yes, sir.
Is that clear?
Yes, sir. It's clear.
Spelling mistakes don't do. Okay.
Yeah.
Okay, are you happy with the feedback?
Yes, sir. Yes, sir. It's good.
Okay, till now you have got almost 5 to 6 letters corrections. What do you feel? Is there any improvement or no?
Yeah, I do feel a little bit more confident actually.
Yes. And today we'll do one speaking session also, okay?
Yes, sir.
Okay, dear. Take care. Bye-bye. I'll send this letter in the Telegram channel. You can take from there, and I'll send you personally also, okay?
Sure, sir. Sure.